Another question that we have is, what is known about the safety and the benefits of those vaccines for both pregnant people and their babies? So when it comes to flu, Tdap, COVID, all of this.
Yeah. So COVID, I think we've pretty much knocked out of the park here with all the data that is available, right? And let me just say one other thing that I think is important for people to know. And my patients certainly ask me about this is, if something develops, are you going to let me know? Absolutely, right? So there is a safety technical group, which is like yet another little subgroup from the COVID vaccine work group at the CDC that is looking at data every single week from multiple safety systems that exist in the US. So the VAERS system is a passive surveillance system, which anybody, a doctor, a nurse, the patient, can write in and say, I took the vaccine and my arm got sore, or I took the vaccine, I got a high fever, or I took the vaccine and my baby was preterm. And so I want to, sort of understand that and report that in. And so anyone can do that. And that we look at that data every single week to make sure that we're not seeing things that make us think, ooh, could that be related to the vaccine or not? Most times it's not, but it's still information that needs to be had. And so that subgroup is available now and looking at safety data on a weekly basis with the COVID vaccines. I can tell you that when the flu pandemic hit in 2009, gosh, I'm old. In 2009, when there was the H1N1 epidemic and pregnant women were dying from the flu, there was this same vaccine safety technical group, and I was a member of the group then. And basically what we did was we looked at safety data that came in from all the different safety systems every single week, because people were concerned about, is there an increased risk of miscarriage? Is there an increased risk of preterm birth and things like that? And so we have that same system set up. I would say that now for flu, we've got years and years and years of safety data. We're not concerned about the safety of flu vaccine. We've got lots of safety data on pertussis as well. Nothing has ever, come about. And so far, what we've seen about COVID has been good as well. But know that we're watching. I mean, and I think that that's really important. And if there is something where we're like, there's an increased risk of this, like the CVST or whatever you want to call it, TTS, they call it a million different things, the one with the blood clotting and the low platelets associated with the J&J, there was no time wasted once people recognized that there could be something a little bit different and could it be related to the vaccine? Maybe, maybe not, but it was much more important for the public to know about it so that they would know how to best take care of themselves. And it was also important for doctors to know, right? Because the way we take care of that particular syndrome is different than the way we take care of somebody else who walks through the door with a blood clot. So that I think is really also important for people to know.